Hi, I'm Dr. Betsy Collins. I'm a generalist gynecologist and obstetrician at Emory University. Today we're going to be talking about first trimester breastfeeding education. The first thing to consider is how you're planning on feeding your baby once you've delivered. If you've had a previous experience with breastfeeding or feeding in the past, then this is something to consider. Did it go well? Did it go badly? What are things that we can improve on going forward? Emory University is a baby-friendly hospital, so we should be providing support for you during your postpartum experience and actually during your prenatal care. So ask questions. This is the time to really get that information so that you feel comfortable approaching your delivery and making sure that your concerns get addressed. So the first thing we're going to talk about are some of the benefits of breastfeeding for your baby. It really strengthens your baby's immune system to breastfeed. It helps set up the appropriate gut bacteria for your baby. It helps your baby prevent colds and flus. Another thing to consider is that with breastfeeding, you don't have to worry about whether or not the water that you're using to make your formula is safe. You don't have to worry about how you mix your formula. Breast milk always comes out perfectly prepared for your baby. You also don't have to worry about over or under feeding your baby, because when you breastfeed, you're going to feed to your baby's hunger cues. So you never have to worry that the baby is drinking too much breast milk. The baby will stop eating when the baby's full. The other thing that breast milk will do is reduce your baby's risk of childhood obesity, allergies, diabetes, and childhood cancers. The other nice thing is, if your baby happens to be premature, breast milk actually will help reduce the risk of complications of prematurity, like gut problems, lung problems, and problems with development. So the other thing to consider is that there's lots of parental benefits to breastfeeding. So for parents, it's a lot easier to breastfeed because you don't have to clean bottles. You don't have to mix formula. You don't have to carry supplies. It's a lot less expensive to breastfeed. It can also help you lose weight and burn calories. Breastfeeding does help burn about 300 to 500 calories a day and can help you get back to your pre-pregnancy weight. If it goes well, it can help reduce your risk of postpartum depression. It can reduce your risk of postpartum diabetes and high blood pressure. And it also reduces your risk of breast, uterine, and ovarian cancer over the course of your lifetime. I have no medications that do that, so that is an amazing benefit. The last thing we need to discuss for first trimester breastfeeding education is the risk of formula feeding. So even with one formula feeding, you can have changes in the baby's gut flora, which are the bacteria and yeast that live in the gut. So it's really important, if we are trying to breastfeed, that we focus on breastfeeding in the beginning, because that's how you set up the appropriate milk supply for your baby. Lastly, let's talk about some of the risks of formula feeding. It's a lot easier to overfeed your baby with formula. It also means, if you use formula, that you lose a lot of the benefits of breastfeeding. So not only the short-term benefits like keeping yourself and your baby healthy, but the long-term benefits like preventing obesity and cancers. There's also issues with mixing formula. It's a lot more complicated than breast milk, which doesn't have to be mixed and is always ready to use. And you never have to worry about water safety with breastfeeding. And then lastly, there's also a question of how to establish your supply. If you're planning on breastfeeding, you should really focus on breastfeeding in the beginning and not plan on using formula unless it's medically necessary, because all the stimulation that will occur in those first few days and weeks of life are what you need to establish your milk supply correctly. All that being said, we're here to support your family in whatever feeding decision you make that's right for you. So if you have any questions or concerns, please let us know. And if you need instructions about how to prepare and use formula safely, we'll be happy to address that one-on-one with you and your family.